Hello, my name is Alexandra Tutwiler. Today's date is April 2nd, 2022. And here is the paper of notes that I will be using for my presentation. So to start, the disease that I chose was Lyme disease, which is a bacterial infection that is caused by the bite of an infected tick. Lyme disease can be transmitted to humans through the bite of an infected black-legged tick specifically, or commonly known as deer ticks. The tick that carries Lyme disease or Borrelia burgdorferi are less than 2 millimeters in size usually, so therefore patients may not know that they've been bitten by a tick or that there was even a tick attached to their body. Lyme disease can be classified into 3 stages. The first stage is localized Lyme disease. The second stage is disseminated Lyme disease, and then the third is late disseminated Lyme disease. So during stage 1 of Lyme disease, it has not spread to the other parts of the body yet, so it's localized in one area. And then in stage 2 of Lyme disease, the bacteria has started to spread throughout the body. And then in stage 3 of Lyme disease, obviously the bacteria has already spread throughout the entire body. Lyme disease can also be classified based on its etiology or causative organism. The majority of cases of Lyme disease are caused by Borrelia burgdorferi. However, Borrelia mayonnaise has recently been discovered to be responsible for the development of Lyme disease in the United States as well. Whereas in other countries such as Europe and Asia, there's Borrelia asphili and Borrelia garnieri, which are the leading causes of Lyme disease there. So as stated previously, in the United States, the etiology of Lyme disease is the bacteria Borrelia burgdorferi, and Borrelia mayonnaise rarely, which is carried by black-legged ticks or deer ticks. And again, these young ticks are often no bigger than a poppy seed, so they're really small in size and nearly impossible to spot on the human body. To contract Lyme disease, an infected deer must bite a person, and then the bacteria enters through the skin and then enters into the patient's bloodstream. In most cases, in order to transmit Lyme disease, deer must be attached for 36 to 48 hours onto the patient. Lyme disease can fall into a variety of syndromes due to all the complications that the infection can cause if not treated in a timely manner. But there is one specific syndrome, which is called post-Lyme disease syndrome or chronic Lyme disease, which occurs in a patient that was treated with antibiotics, and even after antibiotic treatment, they still have lingering symptoms of Lyme disease. Lyme disease is the most common vector-borne disease in the United States, and again is caused by Borrelia burgdorferi. And the clinical manifestations of Lyme disease include fever, chills, headache, fatigue, muscle and joint aches. Swollen lymph nodes may also occur in the absence of the rash. So the rash is called arrhythmia migraines, or EM, and it occurs in approximately 70 to 80% of infected persons. It begins at the site of the tick bite. After a delay anywhere from 3 to 30 days, but the average is about 1 week or 7 days that the rash will appear. The rash will expand gradually and can reach up to 12 inches or more across, and it may feel warm to touch, but the rash is rarely ever itchy or painful, but it does have a bullseye appearance, which happens because as it enlarges, it begins to clear, so it almost looks like a target or a bullseye on the patient's skin. Later clinical manifestations of Lyme disease include severe headaches or neck stiffness, additional EM rashes throughout the entire body on any parts of their skin, facial palsy or loss of muscle tone, and then that causes a droop on one or both sides of the face, inflammation of the membrane surrounding the brain, so it can cause meningitis, arthritis with severe joint pain and swelling, which is most commonly found in the knees and other large joints, intermittent pain in their muscles, tendons, joints, and bones, and then it can also cause heart palpitations or irregular heartbeats. And then you can also develop dizziness or shortness of breath. As I said, inflammation of the brain, spinal cord, nerve pain, can also cause shooting pains or numbness, tingling in the patient's hands or feet, and impaired muscle movement. So the most important Diagnostic tests used to diagnose Lyme disease are enzyme-linked immunoabsorbent assay, or the ELISA, and the Western blot test. So these blood tests or serological tests are indirect, which means that they don't detect the infecting bacteria or even the antigens, but instead they detect the antibodies an infected person's body has produced in response to these antigens. So the ELISA test is used most often to detect Lyme disease, and it again detects the antibodies to B. Bufferia, but because it can sometimes provide false positive results, it's not used as a sole basis for the diagnosis. So that's why they have to use the serological blood test followed by the Western blot test. And also, the ELISA test might not be positive in early stages of Lyme disease, but if a patient has a visible rash, it's usually distinctive enough to make the diagnosis without further testing in patients who live in areas where there are infected ticks. So if the ELISA test is positive, then the Western blot test is then used to help confirm the diagnosis or to confirm the diagnosis. So the Western blot test also detects antibodies to several proteins of the bacteria. And in the Western blot, the antigens are separated by size and then transferred onto a membrane strip. When an antibody reacts with an antigen on the strip, the band will turn dark purple, so it'll create a dark purple band on the membrane strip. And for the test results to be positive, a specific combination of bands on the membrane strip must be present. These tests allow for physicians to visualize the reaction between the antibodies in the infected person's blood to specific antigens or parts of the bacteria that cause Lyme disease. So a positive ELISA result would reveal antibodies in the blood sample, but this does not confirm the diagnosis, like as previously stated, of Lyme disease. This result must then be followed up by a Western blot test, and a positive Western blot test can confirm the diagnosis of Lyme disease. Some Lyme specialists and scientists believe that there are 5 very specific bands on the Western blot test that are highly indicative of Lyme disease. And the Lyme Western blot looks at a series of specific antibodies against the Lyme organism for both IgG and IgM. And if someone has at least 5 out of the 10 antibodies for IgG or 2 out of the 3 antibodies for IgM, then the Lyme Western blot is considered to be positive, and then the patient would be diagnosed with Lyme disease. Some people call Lyme disease a great intimidator because it can be confused with a number of other conditions, including chronic fatigue syndrome, fibromyalgia, multiple sclerosis, or rheumatoid arthritis. So one of the most common Lyme disease misdiagnoses is rheumatoid arthritis, or RA, which is a long-term disease that leads to joint inflammation. And even though it is a very different condition from Lyme disease, they still share a lot of symptoms. So that's why they are typically confused and why RA is a differential diagnosis. So in order to differentiate between rheumatoid arthritis and Lyme disease, a physician will perform an extensive exam asking the patient about their symptoms, medical history, and of course perform an extensive physical exam as well. And then the blood test can differentiate between these two conditions. So blood tests for RA can look for antibodies or rheumatoid factors and proteins that are linked to the disease. And then also diagnostic imaging such as x-rays and MRIs may also be used to confirm a diagnosis of RA. So possible complications of Lyme disease include chronic joint pain or inflammation or Lyme arthritis, particularly of the knee or larger joints like stated previously. Neurological symptoms such as facial palsy, neuropathy, cognitive defects such as impaired memory, and then it can also cause heart rhythm irregularities or Lyme carditis. So again, when the symptoms linger well beyond the typical treatment time, then a patient is diagnosed with post-treatment Lyme disease syndrome or chronic Lyme disease, which can cause fatigue that may linger for years, widespread muscle aches, and severe headaches, all symptoms similar to chronic fatigue syndrome, or also fibromyalgia and arthritis or joint pain, cognitive issues with short-term memory and other thinking skills, and again, Bell's palsy as well, so the drooping of the face, and then heart problems, and of course, depression and stress. Thank you.